Young children were exploited as chimney sweeps, forced to climb into narrow chimneys. Their task was to scrape soot from the chimney interiors. They often worked without protective gear. The confined spaces posed significant dangers to the children. Exposure to toxic dust caused severe respiratory issues and lung damage. Child chimney sweeps faced extreme dangers in their work environment. A significant risk was becoming trapped inside narrow chimneys. Such entrapment often led to suffocation due to the confined space and soot. The lack of safety measures exacerbated these risks. Insufficient oversight and regulation further contributed to the problem. These factors combined resulted in high mortality rates among child chimney sweeps. Toshers navigated urban sewer systems in search of salvageable goods. These sewers were filled with raw sewage and other hazardous materials. The environment contained toxic gases, posing a risk of poisoning and asphyxiation. Disease-carrying pathogens were abundant, increasing the risk of infection. Large rat populations thrived in the sewers, presenting potential bites and disease transmission. These conditions combined to create significant health risks for toshers. Mudlarks were individuals who scavenged along riverbanks for discarded items. This activity was often undertaken by women and children seeking to find scraps. Mudlarking was driven by poverty and the need to find resources. The practice involved searching through mud and debris left by the tide. Mudlarks faced numerous dangers, including the risk of drowning. Exposure to pollutants and waterborne diseases also posed significant health risks. Early factories were characterized by loud machinery and extended work shifts. These conditions contributed to a high incidence of workplace accidents. Common injuries included crushed fingers and entanglement in machinery. Workers also faced long-term health risks, such as lung damage from inhaled dust and fibers. Victorian-era factories often lacked adequate worker protections. Injured workers faced the risk of immediate job replacement. This practice underscored the precarious nature of employment. Job security was minimal for factory laborers. The ease of replacing workers reflected a disregard for their well-being. Matchstick factories historically employed workers, often young women, in hazardous conditions. These workers handled white phosphorus, a highly toxic chemical compound. Exposure to white phosphorus led to a debilitating disease known as phossy jaw. Phossy jaw caused severe disfigurement and was frequently fatal for those afflicted. Phossy jaw was an occupational disease affecting matchstick workers. It was caused by exposure to white phosphorus. The condition led to the progressive rotting of the jawbone. This decay resulted in severe pain and disfigurement for those affected. Ultimately, phossy jaw often caused premature death among matchstick workers. Knocker-ups were individuals employed to rouse sleeping workers. They operated primarily during the early morning hours. Their tools included long poles and, sometimes, pea shooters. These tools were used to tap on windows or doors. This service ensured factory workers arrived on time, maintaining productivity. Knocker-ups faced difficult working conditions. These conditions included exposure to rain. They also had to work in cold temperatures. Darkness was another common challenge. Knocker-ups were poorly compensated despite their importance. Resurrection men illegally exhumed corpses from fresh graves. These corpses were then sold to medical schools for anatomical study. The demand for bodies in medical education fueled this illicit trade. Poverty often drove individuals to become grave robbers. Grave robbers faced significant risks for their actions. They risked arrest and imprisonment if caught. Violence was a constant threat, both from individuals and mobs. Public hatred and social ostracism were common consequences. Some grave robbers even committed murder to obtain bodies. These extreme measures highlight the desperation of the time. Historically, medical schools required cadavers for anatomical study. Cadavers were also essential for surgical training. These cadavers were sourced through both legal and illegal channels. The demand for cadavers often surpassed the legally available supply. Tenement housing served as the living quarters for many working-class families. These tenements were often characterized by overcrowding. Sanitary conditions in tenements were typically poor. Overcrowding and unsanitary conditions fostered the spread of disease. These conditions contributed to poor health outcomes among residents. Tenement housing negatively impacted the well-being of working-class communities. Victorian Britain was marked by a significant disparity in wealth distribution. This era saw a stark contrast between the upper classes and the working class. The upper classes enjoyed considerable affluence and privilege. In contrast, the working class often faced poverty and hardship. This economic divide shaped many aspects of Victorian society. The wealth gap influenced social structures, politics, and daily life. Modern worker protections are a direct result of historical struggles. These protections include safety regulations in the workplace. Modern labor laws also stem from this period. Child labor laws are another significant outcome. These advancements arose from the suffering of the working class in Victorian Britain.